And joining us in the studio now is World Health Organization Country Representative Dr. Abeyasinghe. Good morning. Thanks for being here, Doc. Okay, good to have you on the show. We have a lot of questions regarding the Wuhan coronavirus. First, is the Philippines still free of the disease? Officially, we are.
Officially, as far as we know, the virus has not been isolated or confirmed in any of the people that have been under investigation in the Philippines.
All right, so how many patients are we monitoring for possibly having this new coronavirus?
So as you just mentioned before, it's the patient in Tacloban and two patients in Palawan. The child in Cebu, who was a suspect, is no longer because the test came out negative.
All right, so those two. So tell us more again about the Wuhan coronavirus. How serious is it? There was news that came over the past few days that the virus can be passed on even if a carrier is not exhibiting symptoms. Is that right?
This is not exactly surprising with coronaviruses. The same is possible in MERS-CoV, which is also a coronavirus infection, the Middle East respiratory. So it's not entirely surprising, and it may well be the case, though this has not yet been proven. Right now, what we know is that the incubation period for the virus appears to be somewhere between 2 to 10 days. If this story that patients could be infective before they are symptomatic is true, it would possibly mean that they could transmit the disease in this period. We need to be clear that the coronavirus can only be transmitted through very close contact, droplets or fomites. So you need to be in pretty close contact to somebody who's been infected to actually get infected.
All right, but if they are within this incubation period, which you said is about 2 to 10 days, you could still infect another person if you're carrying it.
Well, that's what some of the reports are saying. This is yet unconfirmed. It's being investigated. We haven't confirmed that.
All right, when we talk about the Wuhan coronavirus, of course, it brings back memories of Sars from about 17 years ago. How does Wuhan coronavirus compare with Sars? Is it as deadly? Is it spreading as quickly as Sars did?
Initial pointers to the fact that it's not as deadly as SARS. If you look at now, we have approximately 2,000 cases and 56 deaths. That amounts to about a mortality rate of about 3 to 4%. SARS had a higher mortality rate. If you look at the number of severe cases, 327, I believe, at the last count of severe cases, that's pointing to a severity rate of about 15%.
Right, so significantly higher. But in terms of the spread, is the Wuhan coronavirus spreading more quickly than SARS?
It's right now difficult to compare the two. What's different between SARS and the Wuhan coronavirus is that the virus was identified much earlier in the outbreak. The confirmatory tests were identified much earlier. So this all points to significant strengthening of preparedness and response capacities in countries, which is a good thing. But that also then gives you the sort of feeling that, okay, this is spreading faster, but that may not be the case. It's because we are simply testing more people because we have tests, whereas in the case of SARS, it took much longer.
Yeah, it seems they didn't even know what it was at the very beginning, right? So at least in terms of public health and containment, the processes are also better and more effective.
Definitely, yes. In this region, we have the Asia-Pacific Strategy for Emerging Diseases that the ministers have endorsed and we've been implementing across with governments, and that has significantly improved capacities across the region since the outbreak of SARS. Yeah.
All right, will the WHO convene again to decide whether or not to declare the corona Wuhan virus as an international emergency?
So it's not the WHO which convenes, it's the International Health Regulations Emergency Committee. The Emergency Committee is a committee of independent experts that is convened by WHO to do an evaluation. The last meeting said there is no evidence right now to declare a public health emergency of international concern. But as the DG mentioned, he can reconvene the committee at short notice, possibly within the next 10 days, to do an evaluation if there is new evidence that needs to happen.
All right, within the next 10 days. And lastly, Doc, for the benefit of our viewers, again, take us through the symptoms, of the Wuhan coronavirus, and at what point should an individual seek medical attention for those symptoms?
So the Wuhan coronavirus causes an acute respiratory disease. So you could start with symptoms of a common cold, a runny nose, a cough, sneezing, and that could progress to shortness of breath, to a bronchitis or pneumonia. What should a person do if you have those symptoms? And this is bearing in mind the fact that this is flu season. Many people may have those symptoms. So what's critically important is, have you been in contact with somebody who's been to Wuhan or Hubei province? Have you been in contact with a confirmed known case or a suspected case? In which case you need to inform your clinician so that they can do the necessary testing. Alternatively, you need to practice good hygienic practice to prevent somebody else getting infected, even though it's not a coronavirus or it's just a common cold in these circumstances. And you need to practice social distancing so you don't infect other people.
All right, hand washing.
Yeah.
Thank you so much for being here again this morning, WHO Country Representative Dr. Abeyasinghe.